Hi, Monica. How are you doing today?
I'm okay, I guess.
Yeah. Well, my name's Isabel. I just wanted to introduce myself and go over just some kind of like housekeeping things before we really get started. Um, so yeah, it says here your name is Monica. You were born May 19th, 1994, making you 29. And that today's date is the 13th of October. Um, do you prefer a different name besides Monica?
No, sometimes my friends call me Mon, but it doesn't really matter.
Okay. Well, as we get to know each other, if you want me to call you Mon, I can totally do that. Isabel works for me, and I'll just continue to call you Monica. And then it also says here that you identify as white. Does that feel accurate to you?
Think so.
Okay. All right, that sounds good. Um, So it does say here that you are coming in mostly for anxiety, um, but that your partner suggested that you talk to someone because of your drinking as well, and that maybe it's starting to affect like your personal life and work a little bit. What would you describe as like your sort of presenting problems or why you're here today?
Yeah, I just think that I'm like really anxious. I'm always like waiting for something bad to happen, always very like worst case scenario. And it's like it'll keep me awake at night sometimes. And like I know it doesn't make sense. I know it's not rational, but like I can't turn my brain off and I can't like not have intrusive thoughts. And so sometimes that makes me really just like irritable and snappy and jumpy. And um I started out just kind of drinking to like a drink before bed to help me like wind down and sleep, and it's just kind of progressed. Like I wouldn't say I drink a lot, but I do sometimes like to just take the edge off that way.
Okay. Yeah. So I'm hearing like mostly anxiety, irritability, these intrusive thoughts, and then drinking to kind of like minimize that a little bit. Is that a good like snapshot, would you say?
Yeah.
Okay. And we'll get into that more. But just before we continue, I do want to remind you of informed consent, which means that if you do indicate that you are likely to harm yourself or someone else, I do have to let someone know I'm a mandatory reporter. Um, but beyond that, this is very confidential. Like, I want you to feel comfortable sharing, with me. Do you have any questions about informed consent specifically?
I don't think so.
Okay. And if you do, just let me know.
Okay.
So I know that you mentioned feeling anxious and like particularly irritable. How long would you say that this has been going on for you?
My whole life, but it's been really bad since I had my second baby like 8 months ago.
Okay. So you've been experiencing anxiety for about 8 months. And what does this look like on like a daily basis for you?
I feel like I can't take my eyes off my baby, like especially when he's asleep, because I'm just worried that he's gonna like magically suffocate. Or I'm always like really, really worried that bad things are gonna happen to them. And so I try not to hover or helicopter around them, but I feel like I can't get anything done because I'm just so worried that, especially the baby, like if I take my eyes off of him, something really bad is gonna happen. I'm like really worried that like my marriage is going to fall apart, which doesn't make any sense because it's not falling apart, but like I just worry about it, and I will like lay awake at night and just picture like bad scenarios and like make a plan for what I'm going to do if like the house catches on fire.
Sure. Yeah. Yeah. Okay. So I'm hearing that like maybe a preemptive event or triggering event was like having your child, right? So it kind of like has been like a postpartum, experience for you, at least higher, right? And just thoughts about like wanting to keep your baby safe, your relationship. And then I also know that earlier you mentioned like drinking. So how do you feel like drinking has played into that?
I don't ever like I wouldn't say I do anything like risky with it. It's like I don't drink and drive, and
Okay.
I don't work. Like I'm a stay-at-home mom, so it's not impacting my employment. My husband doesn't really like it because there is a history of alcoholism in both of our families.
Okay.
I don't feel like I need it necessarily. I just kind of feel like it's helpful sometimes when I'm having a really bad day.
Okay. Yeah. So I'm hearing that you're like aware of it, but it sounds like you would like to focus more on anxiety. Does that sound true? Okay.
Mhm.
That sounds good. Um and apart from anxiety, have you ever had a history of wanting to hurt yourself or wanting to hurt someone else or an attempted suicide at all? No? Okay. Thank you. And then have you or like has anyone else ever described you as manic or like hearing things or seeing things that maybe weren't there? No? Okay. Thank you. Um, and then I do want to talk just a little bit about past treatment. So have you ever been to therapy before or anything like that?
Mm-mm.
Okay. Well, thank you for being here. I'm excited to work with you. I know it can be scary. Um, so then I'm assuming you've never been prescribed any medication before.
No, but I am on the wait list to see a psychiatrist to get help.
Okay, that is helpful information. Thank you. And just in relation to anxiety, I'm assuming.
Yeah.
Okay. Um, and so then have you ever been an inpatient, like 24-hour care or hospitalized? Okay. Um, and no suicide attempts, you said. Okay. Um, I do want to talk a little bit about like family history now. I know that that can be difficult for some people. So if there's anything you don't want to talk about, you don't have to. Most of these questions are going to be general. So, like, if there's something that I think is noteworthy or you do want to talk about later, I'll note it, but we don't have to get like really into it right now.
Okay.
So is there any family history of psychiatric illness that you know of?
Yeah, my dad has really severe ADHD and like a depression and anxiety. I think my mom is kind of anxious, but I wouldn't say she has anxiety necessarily. My brother actually does have a really rare genetic neurological disorder, but I also think he has ADHD. I don't know. It's really hard to separate like those things from him, but mostly my dad is just very anxious and like severe ADHD
Okay.
and depression.
Yeah. So I hear you mention ADHD a lot, like with your family and potentially with yourself. We won't cover that too much today just because of time, but I do feel like maybe that's worth
Mhm.
talking about later or like getting you assessed for if that hasn't already happened, just if you want.
For sure. Yeah.
Okay, cool. And then history of substance abuse. So do you feel like you've ever struggled with substance abuse or anyone in your family?
My brother drinks a lot. I would say my brother's an alcoholic, and I've noticed more now that my dad's not a pastor anymore, which is what he used to do. He drinks quite a bit more, and he's like really weirdly secretive about it. And they just like go through a lot of alcohol in that house. And I don't know if my dad's an alcoholic at this point, but my brother is for sure.
Okay. Well, I appreciate you being honest about that. I know it's hard to talk about and even though, you're here today because of anxiety, like that's always something that we can talk about with you or your family if you want to. Okay. Um and then how would you describe your family um growing up? Like I know you said you have a brother and then your parents like are you guys close? How would you describe that?
Yeah, until lately we've been really close. They've been going through some stuff that we could probably talk about later. That's been like really hard for them and they haven't been handling it well. So we're not super close right now. But growing up, yeah, it was just my parents and my parents are still married. They've always been married. My brother is 5 years younger than me, and we were all really close, like really, really close. Like my friends all wanted to come to my house because my family was just very kind of like you would see in the movies, just very tight knit. We laughed a lot, had a great time. My parents were very hardworking, kind of did what they could to make ends meet. My mom was a stay-at-home mom. My dad was a pastor and a mental health professional. Um, and yeah,
Yeah. I mean, it sounds like obviously there's like some recent stressors, but overall, like you admire them, you feel close to them. Um, I know you mentioned like your anxiety being worse because of, or like since the birth of your son, but do you feel like this recent stuff with your family is like contributing to that also? Okay.
definitely.
Yeah.
Yeah.
And that makes sense. That makes sense. And that's definitely something we can talk about in future sessions. Um, and then have you ever, or are you currently married?
I'm currently married. We have been for 5 years and we have two little kids.
Awesome. Congratulations. Any history of military service?
My husband is an army veteran, but
Okay.
not for me or my family.
Okay. And I know this is can be a sensitive topic slash question, but have you ever experienced any verbal, sexual, or physical abuse?
I don't think so. No.
Okay. Okay. And then how would you describe your support system
I
or
would say
lack
right
of?
now it's just kind of me and my husband, because my family's kind of dealing with their own stuff. Like I think they try to be there for us and they like watch the kids for us sometimes and stuff, but right now it's just kind of us on our little island. My husband's family sucks. So we don't have them either and neither one of us have a ton of siblings, so
Okay. Yeah. So small, but there's quality there for sure, maybe.
mhm.
Okay. Any history of legal problems?
No.
Okay. And then in general, have you ever been hospitalized or sustained a significant injury? Or do you have any allergies?
No, I mean, like I've given birth twice. So I've been in the hospital for that. I have hypothyroidism, but other than that, nothing.
Okay. Okay. Um, and then from my impression, it seems like, you are doing your best to manage your anxiety, like pretty well kept. We've been able to like have a good conversation. Would you say that that's true for you as well?
Yeah.
Okay, great. So, it's my impression and probably yours as well that you're just struggling with anxiety. It is something that you're familiar with, but would still like help with now. And I think going forward in the next session, maybe we can talk about like some treatment goals and planning. How does that sound?
Sounds good to me.
Okay. Well, Monica, it was really nice to meet you, and I look forward to seeing you again.